Welcome to the Open Innovator, a captivating journey into the intersection of technology and imagination. Innovation isn't just a buzzword here, it's a way of life. We unveil the stories of creators and pioneers, shaping the future with their groundbreaking ideas. No more complex jargon, just accessible innovation stories. So whether you are a tech pro or an explorer, you are in the right place. Our mission is to demystify innovation, inspire dreamers, and invite you into the Open Innovator community. Today, we venture into a HealthTech, spotlighting a startup called MedTel, who's transforming healthcare. So buckle up, stay curious, and let's explore endless innovation possibilities. Hello viewers. So the day is special, not because we both are wearing the same color dress, but because the topic that we'll be discussing today is very close to my heart. It's healthcare. And we have the doctor himself. We have Dr. Timresh, the founder of a leading healthcare startup, MedTel Healthcare. Welcome, Dr. Timresh. Welcome to the Open Innovator Show.
Thank you, Naman. Thank you.
So let's start and kick off our conversation by talking about MedTel and what inspires you to start MedTel.
Obviously, what inspired us to start MedTel was more of filling the gaps in healthcare. Being a doctor coming from a area where like healthcare, it's not a metro city. It's not full of big hospitals and stuff. So healthcare is still a necessity there. And that is what encouraged us. That is what gave us the kick to start.
Right.
So the idea always has been to take healthcare to the inaccessible areas, whether it is in terms of geography, whether it is in terms of a socioeconomic status, whether it is because of any other reason. So that has always been the inspiring factor for us.
If I simply put it, do you believe or do you feel there is again a scope of great improvement within the tier 2 and tier 3 sectors or the rural areas particularly?
We have not yet even scratched the surface of telehealth.
Right.
We've been talking about telehealth for long.
Right.
We have had initiatives since early 2000s, 25 years now. Incidentally, COVID came and it just pushed things into a better adoption mode, but we are still just scratching the surface. It can help us go into remote areas, rural areas, empower patients to take control,
Right.
to be part of their treatment journey, to empower healthcare providers by freeing up their time, by easing systems for them, as well as providing them a more up-to-date, more accurate data in different forms.
Also, Dr. Timresh, to all our viewers, right, who is watching this show, help them understand in the very layman and very nascent language ki exactly MedTel karta kya hai, right? I believe you are also carrying your kit, right? Probably we can see that as well.
So this comes like a set of devices. Now all
Okay.
of these are IoT medical devices. So
Can we have a look, please? Okay. So these all are IoT devices, is it?
these are all connected medical devices.
Okay.
So what happens is they speak directly to the application or to the platform. And then from there, the data is transmitted in real time, smoothly to the healthcare provider. We run a lot of data analytics on it, draw out inferences for individual people like you and the person who is being tested.
Right.
We give insights into that. We give predictions into your health, different kind of diseases that you are at a risk of. And at a bigger level, let us say at a healthcare provider level or a policy level, we
Okay.
help in taking very data-informed decisions by whoever has to take that decision.
Now, can you also, talk little about how MedTel devices and the app work together in a closed ecosystem to help patient engagement and actually help the end users?
The idea has been always to have a as open as device agnostic, disease agnostic platform
Right.
in all ways.
Right.
So what we have done is we have created a platform into which multiple connected medical devices can connect. The broader idea is like any device you pick up, any connected device, any IoT medical device we pick up should be able to talk to the platform.
Sure.
So that is the broader idea. At the same time, easing out the usability by the end users. So in our case, it is usually the healthcare providers, nurses and all.
The market is full with lots of medical devices, correct? So for every device, there is a unique mobile application or a dashboard that we have, right? So if I have understood it correctly, by using MedTel as a kit, in just one common dashboard, I'll be able to manage 10, 12, 15, 20 different devices.
Okay, so I'll tell a bit about our journey also. So we didn't start as a platform or a SaaS company.
Okay.
We started out as a healthcare service provider in absolute remote rural areas.
All right.
So we faced this issue of getting the data. Like getting a doctor on a phone call or a video call was very easy.
Okay.
Getting the patient to get a blood sugar reading or an ECG was the bigger challenge.
Okay.
Anyway, the person has to travel to, 20 kilometers or
Sure.
20 days to get that data, to get that diagnosis done.
Right.
We started experimenting with it.
Right.
And why we choose connected medical devices is because it ensures two things. One is it transfers the data immediately. That is the speed thing. And then there is the accuracy, because no matter what we do, there always are errors in manual entry, writing down something, typing out something.
Right.
But in this case, what happens? The data comes into the platform very cleanly, very directly. And as you rightly said, once we started using these devices, we started facing every device has a different protocol. It has a different communication. It has a different application. It has a different dashboard to see that data. So we built this platform in which all of that can communicate. And as a healthcare provider, as a user, it should not be a challenge to use whether 5 or 10 or 20.
Right.
And similarly, depending on the use scenario, we also customize our kit by we put in different devices. It can grow or come sync depending on the requirement.
So during your initial growth years, what were the challenges that you faced and how did you overcome them? If you can just talk a little about that.
A startup journey is always full of challenges. Variously, we face the common challenges in technology, developing the technology, user adoption, because we are talking about, again, pre-COVID times when telehealth was still a bit of a barrier in adoption. All those adoptions we obviously faced. As I said, we started out as the healthcare provider in rural areas. We pivoted from that to focus on the platform, because we thought the platform is big enough, and then maybe we can actually empower other healthcare providers of all types to improve their services. So that is when pivot happened in 2019, already 4 years now. Now after that, we have iterated a lot. We have got feedback from different users and then improved our systems accordingly. And also we are scaling accordingly.
No, I'm
Next
sure.
thing, and then improve on it, and then you multiply and scale it.
And especially, penetrating deep into the remote areas is not as easy as it looks.
We talk a lot about telemedicine, telehealth, all that, but then actually in the field, if you go, there are areas without phone connections, without internet, without anything. There is no network at all.
Correct.
So for that, our system works on an offline mode also. So
is it?
Yeah. So we can collect the data. Obviously, it won't sync. But then once we are back,
once we are back into the network zone, it again. Okay.
I have visited places. There's no network for kilometers and kilometers.
What does the roadmap for MedTel looks like, and are there any new initiatives that are coming up?
We have been working on maternal health initiatives, really digitizing the antenatal health checkups, the pregnancy which happens in pregnant women. Across, we started out 2 years back with the small pilot kind of a thing. Then over the 2 years now, we are scaling it up. Imagine 200, 500 ANMs using this system, and then all the data getting updated, all the block level program managers getting real-time access. The follow-ups are better. The feedback loops are faster now, shorter now. So that is one thing. Similarly, on the insurance side, person takes a policy, does not fulfill their health checkups, and then the period expires, and then they have to do the whole thing again. So what happens, and that is very typical in tier 2 and below. So what happens with our systems is the person goes, visits the applicant's home, does the tests, does a video MER, goes out of it, and everything is cleared off in the same day.
Okay.
It takes 1 hour, 45 minutes to finish up with one person completely.
So as we speak, if you can also talk about the kind of penetration you have done within India, right? What are the states that you cover as of now, right? I remember you are working in districts in Odisha and then somewhere in deep down south also, right?
We work across the country. We have deployments in Bihar, we have deployments in Tamil Nadu, we have deployment in Karnataka and other places also.
Right.
So it is not a question of the region, because it's adaptable enough, scalable enough to go anywhere.
Right.
Similarly, we have deployed in for employee wellness across different sites.
Okay.
So where we can actually do screening and follow-ups for like 1,000 workers,
Right.
which normally maybe they were doing it once a year just because of regulation. Now they are much more proactive, taking better care of their health. So the regional thing does not really matter. We even have work in outside of India in a few countries in Africa. We have started out.
You mentioned a keyword called employee wellness, right? Quickly, if you can talk about some of the parameters that your devices calculate. If I talk about particularly in the employee wellness program.
The employee wellness space, we are primarily tracking the basic parameters which are regularly done, like your weight, BMI, blood pressure,
Okay.
then blood sugar,
Okay.
those kind of things.
Mm-hmm.
But then every 1 month or every 3 months or every 6 months, you can also do more advanced tests, let's say the lipid profile, even HbA1c, ECGs. Those also are available at your site.
You work with large number of customer data, patient data to be specific. You must be managing it in cloud, right? So how safe is that?
I mean, data privacy and security we take very serious. And we are HIPAA compliant. We have done the audit, we have cleared it. That adds a layer of confidence. Maybe just a stamp, but it adds a layer of confidence. So we are following all kind of encryptions, user restrictions, and obviously the cloud infrastructure itself is secure. So that is not an issue in any way. But also, I think we missed out on one point earlier about the roadmap. And when you reach the data thing, it came back.
Okay.
So what happens is, obviously, as you said, we get a lot of data from different streams. So one thing is, obviously, we're already doing different kind of analytics, but the idea is to grow it, and we are actually developing AI/ML solutions with that data, which can give predictives for different patients as well as population level. So coming from a analytics to going for more predictives using AI/ML is what we are doing now.
Right.
Along with that, we are developing something called a hub, like we call it the MedTel hub. So that basically is like a router which stays inside your house, like an Alexa in your home.
Okay.
And then you don't have to go through an application and this and that. You just do your test. This is primarily for home use, primarily for the older demographic. The older people who are not that comfortable. Like, take example of my father or your father.
Pretty impressive, Dr. Timrej. And where can we buy that?
You can place a pre-order. It's still in like final stages of testing.
Well, I'll certainly be one of your early customers, right? And that sounds really futuristic. I believe you're working closely with the government bodies, right? You're working with the private players, corporate players. Now, if we talk about the remote setting areas or the rural areas, right? How can they get access to the complete MedTel hub? That's what you call it. Or how can they get access to the MedTel resources?
We are a completely B2B company. So the end patient, we are not providing services directly because somewhere we believe that should be the realm of the healthcare provider on the ground.
Makes sense.
We are not going to interfere with that relationship that exists because that is very important.
Right.
What we are doing is we are empowering everyone with the technology so that they can do things better.
Right.
And reach out to those remote rural areas in a much comprehensive way, let us say, and do all these things easily.
And how big is your team right now?
We're around 25 people working out of different places, primarily Bangalore and Bhubaneswar, and then spread out.
So that was lots of tech involved in the last, I would say, 5-10 minutes, right? So now time to lighten up the mood, okay? And it's time for our special segment for today, which is the rapid fire side chat. If you had to choose a theme song for MedTel, what it would be?
Of my mind, I think Staying Alive, the Bee Gees, old song, but it talks about survival, fighting, and then coming out, and then that's what relates in terms of startups as well as healthcare.
Well, simply love this choice. So, all right. If you could give MedTel's technology or the tech stack to any historical figure, who it would be?
You'll be like, I'll go with Charak, like old Indian doctor who didn't have these things.
The father of medicine in India.
Yeah.
So, what's the weirdest or the most unexpected use of MedTel solution that you have seen in the recent past?
One time, what happened is we were testing the devices like going on, and we ran out of blood sample, and then as a joke, our team started testing with like different gravies of
Is it?
so they tested the sugar content in chicken, the lipid content, then opening up tiffins of everyone. So like say what people are eating.
That's a pretty unique food test, viewers. So next question, Dr. Timresh, if MedTel were an animal, what it would be?
Well, maybe a chameleon, because we adapt a lot according to the requirements and to the use case.
Perfect. You are pretty smart and very good at it. Thank you so much for indulging in the fun, Dr. Timresh. It was a great session and you answered it like a pro, like you've been practicing it for years. With this, viewers, we have now moved to our last segment of the day, and where we ask our special guests, to share the words of wisdom for technopreneurs, entrepreneurs, one-upreneurs, and everyone who's watching this show, right?
I would count myself as wise enough to give words of wisdom, but yes, to all entrepreneurs out there, whoever is trying to build something, trying to build that journey, one thing would be to believe in their ideas, believe in the power of ideas, have that conviction to pull through, but as well as have the flexibility to decide when to change direction. That is one important thing. Another thing would be to really keep the ear on the ground, to learn and adapt accordingly. And then what is key there is that the change is constant. That challenge will always remain. And that challenge is not something we have to be afraid of. Like that famous saying that no plan survives contact.
Correct.
It comes from the battlefield, but it is true of everything. So you have to be adaptable. You have to be open to that. That is one thing. And then throughout all this grind, don't forget that you are human. We all are human. We have to keep that. We have to maintain our own sanity. We have to realize that our users are also humans. They are not just numbers. They're not just a user.
Right.
So that human touch should be there, because without that, the entire journey is maybe it's a little less enjoyable. And also at the same time, we should enjoy the journey. I mean, for everyone, we should enjoy that journey, because that is the main, that's the main thing. That is what makes us learn. That is what makes us keep going.
No, very powerful words, Dr. Timresh. Powerful words. It's truly a pleasure to have you with us today. And you are an inspiration, not for all the one-upreneurs or the technopreneurs, but for everyone, who want to pursue their career into the health tech domain. And the conversation that we had with you today was truly an eye-opener. And there is a lot of work that is happening, especially in the tier 2, tier 3 cities with the technology like MedTel. So viewers, watch out this space for more such engaging sessions. And once again, thank you, Dr. Timresh. True pleasure to
be here. And thank you.
And there you have it, folks, a journey into the heart of MedTel healthcare, where innovation meets compassion. And remember, healthcare is all about empowering lives. Keep innovating and keep pushing the boundaries. Until next time, stay curious and embrace the endless innovation. This is Naman Kothari signing off with excitement for what's to come.